Just after the Affordable Care Act, Obamacare, passed, Danielle Nelson and her husband left corporate jobs and their high-end health insurance. Scott started his own consulting company. Danielle took time to focus on the kids.
All right, Taylor, we're going to work on your spelling.
But out of the blue, a year later, she was diagnosed with blood cancer.
7.
Like most people, she went to the web and learned that because of Obamacare, she was guaranteed a new policy at a competitive price, despite her cancer diagnosis. She even found one through the state-run website called Covered California.
Great, I was actually very excited about it.
Danielle chose a top-shelf Obamacare plan with Anthem Blue Cross for their family of 4. And most important to Danielle, the state and Anthem confirmed she could keep her same oncologist. But that's where things started to derail. Her doctor didn't take the new insurance after all.
And the night before my PET scan, I get a call saying we don't take that insurance. And I about cried because I don't know what more you can do.
To be clear, the doctor did take Anthem Blue Cross, but not if it was purchased through the marketplace, Covered California. She says this logo on your card makes all the difference.
It's almost like the stamp of the scarlet letter, you know.
For Danielle, doctor after doctor kept saying they would take her insurance, but not if it was purchased through Covered California. This might help you understand. It's like shopping for clothes, Nordstrom's and Nordstrom's Rack. Same name, but a discounted price for a much smaller selection of clothes.
And so there really is two-tier insurance here.
And the Department of Insurance, though, is going to come in.
Jamie Court is with the group Consumer Watchdog.
I think it's really not being honest with the public to say that these are the same products when clearly the networks of doctors and hospitals are much, much smaller.
Nationwide, a McKinsey study found 70% of new Obamacare plans have what it calls narrow doctor networks. In California, Anthem told us they're paying doctors less in the plans being sold on the state exchange. But the man who runs that exchange, Peter Lee, defends the system and says going forward, that's the way things are going to be.
Not having every doctor in every hospital doesn't mean you get worse care. In often cases, it can mean you get better care. The days of every plan offering every doctor are gone.
For Danielle, things have turned out all right. Eventually, she did find one high-deductible health net plan that lets her keep the same oncologist, and her cancer is still at bay. Dr. Sanjay Gupta, CNN, reporting.